From the News Channel 5 Network, this is Open Line.
Hello, everyone. Welcome to Open Line. Glad you're with us tonight. We have a really good show, an opportunity for you to call in and get some of the latest information on what's going on with the coronavirus. It is, of course, Wednesday, August 26th, and the coronavirus remains what everyone is talking about. Schools are now back in session, and what impact is that having as far as statewide, the numbers on the coronavirus? Happy to have with us the Commissioner for the Tennessee Department of Health, Dr. Lisa Piercey. And she is joining us, as all of our guests do now, via Zoom. Dr. Piercey, thank you for being here.
Thank you for having me. I'm looking forward to it.
Well, thank you. We've seen you there with the governor answering lots of questions. And we appreciate you coming on here and taking calls from the viewers and answering our questions. And so I'll just start with, where are we right now? How is the state of Tennessee doing? Where do you, in your opinion, where do we stand right now?
You know, I sure am happy to report that we are in a much better place now than we were 30 days ago. The governor used the phrase yesterday, cautiously optimistic, and that's what I am too. You know, all of our areas in Tennessee, both metro and rural, are stable to declining. We've first seen the decline in our large urban areas and then in our mid-sized cities, and we are starting to see some stabilization and hopefully soon to be decline in our rural areas. And that's pretty much the same trend that people have seen nationally, and it's what we're seeing here in Tennessee.
Are we seeing a decline in testing? Could that be a result of fewer people going and getting tested?
Yeah, that's a good question. And we're seeing a little bit less testing, but not drastically. For example, our weekly average is still running around 20 or 21,000, our daily average, 20 or 21,000 tests per day, which just blows my mind to even think because, you know, rewind the tape 4 or 5 months ago, and we were really lucky to get 3,000 or 4,000 a day. So, you know, we've got a lot of testing, but it has come down a little bit, particularly from early to mid-July, where we were running in the 25 to 28,000 per day average. And we think that's for a few different reasons. One, fortunately, the best reason is we think there are less sick people. Not only are case counts going down, but something that we watch is called COVID-like illness syndromic surveillance. That's a really long term for a way that we track people who are going to emergency rooms with COVID-like symptoms. This is exactly the same as we have done for years and years for influenza, and it is the best what we call leading indicator, which tells us, are we about to see a spike in cases or are we about to see a decrease? And our CLI curve started going down in mid-July. So we actually think there are less sick people out there. You know, another thing that leads to a little bit of decreased testing is you'll remember in July, we had very significant wait times, and we call those turnaround times for our labs. You know, some people were waiting 7 or 10 or even longer, 10 days or longer. And that was dissuading people from getting testing, which was a really bad spot to be in. So I think people thought, I'm just not going to fool with it because it's going to take too long. And so some people didn't get tested for that. Fortunately, those lab turnaround times are really, really improved now. And I think people are seeing that when they get their test. So our testing numbers are stable.
I did want to ask you that because that was an issue. And we've done a story. I think we were showing some video of it while you were talking there, where the turnaround times for testing were very long. And are you saying they are better now? How long, if I went to get a test, how long should I expect it to take for me to get the results?
Great question. So the short answer right now, about 48 hours. And that is about right, what it should be. But back in the first, second, third week of July, you'll remember, you know, the levels of cases were really low in June, relatively speaking. And then all of a sudden there was this big upsweep in the curve. Well, there was a flood of demand and the labs just couldn't keep up. Not a problem unique to Tennessee. It was something that was felt all over the nation. And so the labs really worked hard to scale up. and did a good job with that. And so now there's plenty of lab capacity, and our average turnaround time for a statewide average yesterday was 2.13 days, but many of our labs, well over half of the labs running Tennessee specimen, were less than 2 days. And we've heard that now. To be fair, we've still heard some prolonged anecdotes, but we've also heard some anecdotes of very short turnaround times. I mentioned yesterday of one of our colleagues who had to have some pre-travel testing, went one afternoon and got results the next morning. So that's really improving nowadays.
So the turnaround time, 48 hours, that's great. So hopefully that will continue, a 48-hour turnaround time. You mentioned that we're doing better. You mentioned also rural counties are maybe coming around. You look at the 7-day infection rate in Tennessee counties, and you do see, Davidson County, a bigger county, there's a number here of 15.2. That's 15 cases per 100,000 residents. Williamson County is 13. Lauderdale County is 67, and White County is 61. And then there's several other kind of rural counties that are above 50. So new cases daily seem to be increasing at a higher rate in some of our more rural counties. Is that right?
That's right, but I would point you back to a few weeks ago. The rates in those larger cities were really high then too, and they've come down. And so we think this is a function of time. And I'm very hopeful and don't have any reason to believe that in another 2 or 3 weeks from now, those rural counties that you mentioned will be in those lower numbers. The other thing that's unique about our rural counties is that is where our older and sicker population lives, by and large, not always, but by and large. And so they might be at higher risk for getting it, and they certainly might be at higher risk for poor outcomes. So we're tracking the cases in rural Tennessee closely because that's a very important segment of our population.
Do you know what is happening in White County? That's in our viewing area. That's why I asked about White. 61 cases per 100,000 residents. Do you know, is there some specific thing happening there, or you think it's just a lag, or do you know?
Yeah, I don't know of any specific large clusters there or any unique factors. I think it's just another, it's following the pattern of a lot of our other rural counties, at which if you get pretty far outside of just the collar counties of metros, you're starting to see those higher rates.
Do you think these rural counties would be better served if there were a mask mandate?
Yeah, that's a hot topic that we've talked about a lot. And, there's no question that wearing masks are an effective tool in fighting the spread and reducing the spread. I will remind folks that there seems to be this narrative that there is only one way to get people to wear masks through a government mandate. That's actually not true. There's a lot of different ways to do that. That is one effective way, but there are many private sector ways to do that too. And we've seen lots of companies, Best Buy and Walmart and Kroger step up and say, if you're going to come in our business, you're going to wear a mask. And we're seeing that with schools and workplaces as well. So there's lots of effective ways to do that, but there's no question that masks are effective in reducing the spread.
We have people call into this show who say they're not going to wear a mask, say things like it is not healthy to breathe your own carbon dioxide, say things like it hurts their teeth. We have people calling into this show repeatedly, emphatically saying they're not going to wear a mask. Then when there's not a mask mandate, they think, well, we just don't have to do it. I guess as health commissioner, I think there are people watching this show who think it's not healthy to wear a mask. There's some side effect to wearing a mask. What do you say to people that believe that?
Yeah, well, that's kind of ironic when I hear that, because I spent years of my training wearing a mask in surgery and in ORs and in hospitals and in ICUs. I think there's a lot of professionals that wear masks all day, every day, whether it's in the medical field or in construction. Sometimes hairdressers or nail salons will wear masks. They're perfectly safe to wear. It does not trap the carbon dioxide in. It doesn't cause you to rebreathe it. It's as long as you can get air in. And let me be clear, there are some people that have breathing difficulties that wearing masks make it more difficult to breathe. And in those situations, perhaps they need to talk to their doctor before they do that. But for the vast, overwhelming majority of people, wearing a mask is just perfectly safe.
So if that is the case, as health commissioner, why not mandate? Why not push for mandating? It may not be your decision. Why not push for mandating masks all across the state, especially we're seeing this rise in rural counties?
Sure. I mean, that's a fair question, and one of those that really talks about strategy and what is the most effective strategy to get people to wear a mask. Because as health commissioner, I don't care why they're doing it. I just want them to do it. And whether it's a governmental mandate or private sector policy or just a personal decision, then I don't care how they get there as long as they get there. You know, the governor has frequently said, and I wholeheartedly agree, that government works best when it's closest to the people. And Ben, I know you would agree that Grundy County is very different than Shelby County, and Lake County is very different than Knox County. And so the mayors and leaders in those communities, not only do they know their communities better, but they would actually probably have better buy-in than someone in state government who they don't know. So, or don't know personally. So lots of different strategies. I don't care how you get there as long as you wear a mask.
And so, yeah, at this point as health commissioner, you're urging people in rural counties to wear a mask, and you're telling people it's safe. That's where you stand right now. And all right, so we're seeing numbers are getting better, and you said there's this lag. And so my question would be, we're going back into school now. We're going back into school all across the state. Do we know yet if that is having an impact? There's been a concern that, you know, that could, of course, increase the spread, increase the numbers. Is it too early to tell if kids going back into school in really every district across the state except for Davidson County and Shelby County, so all across the state they're going back in? Do we know yet if that is having an impact on the numbers?
I think it is still too early to tell. You know, the very first school district opened right at the end of July. So that would be the first one. But the bulk of all of the school districts across the state started last week or this week. Some of them started a little bit earlier in August. It's a little too soon to tell, but I can guarantee you there will be cases in schools. We know that there are going to be cases in schools, and so we've worked really hard to prepare our schools and to prepare our teachers and administrators and district leaders on what to do when that happens. Because when people start moving about more and interacting more, we know that's how the virus spreads. So, but we haven't seen that yet pan out in the state numbers. There's
been some concern among parents about whether the state's going to report the numbers of cases as they emerge in schools. I think at one point, at first, the state said no, then they said yes, and I think now they're back at no. Where is the state on reporting cases in schools? Yeah, let me be very clear. We want to be as transparent as possible and give absolutely as much information as we can to parents so they can make informed decisions. As a side note, you know, I'm a pediatrician, and I have always said that there is no person that knows a child better than the parent. And the parent needs to be informed with the data points that he or she needs to make good decisions. And the reason I kind of chuckle is because we desperately want to be transparent and give that information, but there are a lot of privacy concerns that we're having to work through. And this is one of the, I guess you could say, downsides of being one of the national leaders. You know, we're one of the first states to go back to school, and certainly one of the first states to start reporting this. And so we're working through some issues related to both HIPAA, which is patient privacy, and FERPA, which is educational privacy, and how those two interact. I do feel encouraged that we're getting closer to that, and looking forward to maybe in the next couple of weeks being able to produce some more helpful data. Does that mean HIPAA and FERPA? Does that mean you feel like you're not sure? Let's say there's a high school and you say there are 10 cases in that high school. Are you afraid that by saying there are 10 cases in that high school, you will identify somehow the students that have it? Is that what you mean by privacy concerns?
That's right. And it's all about the risk of re-identification. And I really understand that that's hard for people to wrap their heads around, because you think, oh my goodness, how could you re-identify 10 kids in a high school of 2,000? A couple of points to remember. One, we have schools of all different sizes in this state. We have very large schools, and we have schools that are down to 50 kids. And so you have this a little bit different scenario in each of those. And secondly, in at least HIPAA laws, and I believe the same to be true for FERPA as well, I'm less familiar with educational privacy, but there are a set of, I believe it's 18 indicators that when put in combination, there's an algorithm that can cause you to re-identify a child. I know that seems hard to understand how that could happen, but those are federal privacy guidelines that we must comply with, and particularly as it pertains to FERPA, that's associated with funding, and we don't want to do anything to jeopardize that. So we're trying to be extra cautious, but I promise you we are trying to get there as fast as we can.
So the funding comes from the federal government, right? And you're asking the federal government about if this would violate those rules. Is that correct?
That's right. And you know, we all have to remember this is a completely unprecedented situation. I cringe to say that word because it's overused, but it's true. And this is something that we've never really dealt with. This level of data transparency as a nation, I mean, and this type of need for information, but also simultaneous need for privacy. So we are working with our federal partners. We're working with a host of attorneys and the Attorney General on just how and what level of information we can share, because we know parents want it and need it.
To be a bit cynical, one might think the federal government may not want those numbers out there, and they may say, we don't want you to release them. Because it does seem a little hard to believe that if you say there are 10 cases in this high school, that you've identified the actual student, and that the need for parents in that school to know would outweigh the concern of identifying 10 of 2,000 students. And I know there's some smaller, but it seems like the need to know would outweigh that. And I guess, are you pushing the government on this? Are you saying we really want to identify these and we want to get clarification on this? And are they pushing back? How are those conversations going?
They are being our federal partners are being incredibly supportive and helpful, and they're navigating through these waters just as we are. I think their motivation is exactly the same as ours. We all want to give the most appropriate amount of information to parents so they can make good decisions. We also have to weigh the privacy concerns of some parents, and I know it's kind of hard to think, like, why would a parent want to keep this secret? But there are some parents who are very protective of their child's information, and we want to respect that and balance privacy with the data transparency. But our federal partners have been nothing but incredibly helpful and supportive as we're going down this road. So
we'll look for that in 2 weeks. Hopefully there will be some clarification. And just a little more on that, as far as, let's say you're in a classroom, and again, counties outside of Davidson and private schools and the like, they are in right now. There's a child in a classroom of 25. One child gets it. Is every parent in that classroom notified, or how does that work?
That's a good question. It is the parents of the child's close contacts. And this brings up a good opportunity to talk about what is a close contact. A close contact is someone that has been within 6 feet of an infected person for at least 10 minutes. And so if you think about a traditional classroom, that could involve the people who the other children that sit right around the infected child. If there is proper spacing, acknowledging that sometimes that's difficult to do, but if there's proper spacing, there might not have been anyone in that scenario, but more likely there will be a handful of kids that were considered or are considered close contacts. So those parents will be contacted and ask their child to quarantine for 14 days while the infection period plays out, and then they'll be allowed to return back to school.
So again, there would be parents. That means not every parent in that classroom would know. And you said how important it is to be transparent. If you were a parent and there was a child at school, your child at school, and a child in his classroom was sick and you weren't notified, do you think that's appropriate? Don't you think that parent should be notified if there was a child in his classroom who was sick?
So I think you may know I have 4 children, 1 in college, 3 in high school, and that has already happened. There's already been a case in my child's school, in my children's school. And, I'm reassured that my children were not close contacts. And so while I feel bad that child is sick and that there are other contacts that are having to quarantine, I know as a physician that my child, if he or she were not within 6 feet for 10 minutes or more, is not at any more risk than they would be from anybody else. So from a health standpoint, I'm comfortable with that.
You're comfortable with that. And so how would a parent get information if they wanted? I guess they can't, right? I mean, if they want that information, it would be up to the student to divulge it. Is that right?
It's actually the school has the ability to do that. The school, in consultation with their school board and particularly their school board attorney, they have the ability to report that at the school level if they choose to do so. And we're seeing that many of them already are. In fact, the vast majority of the ones that already have cases are reporting themselves. And so in that scenario, the school would notify the parents. And like I mentioned, that's already happened at my children's school. I've got a call late Friday that there was a child infected, and that was the appropriate flow of information for that day.
And you would hope that the school district would do it, but there's no mandate that the school district even has to do that, right?
That's right. And admittedly, there are some school board attorneys that are not comfortable with that for the exact same reasons that I mentioned earlier, trying to balance the privacy concerns. And those are the kinds of things that we're working through and trying to get past so we can report the data so parents can have as much information as they need.
And my last question along these lines, how do you think we're doing? Do you know how we're doing with schools? Do you know how many are closed? How do you think we're doing? It is early, but how do you think we're doing as far as COVID in schools now that so many are open?
Yeah, that's going to be a really good question to ask in about 30 days when when all the schools are open. Some schools just opened this past Monday, and so it's a little unfair to talk about how many are open or closed because some just opened a couple of days ago. But rough numbers, last time I checked, less than 1% of our schools who were open in person have had to close because of COVID. So that is a very early but encouraging statistic.
Okay, that kind of sets the table. So I encourage now people to call in and appreciate the commissioner to being here to answer our questions. There's the number on the screen, 615-737-PLUS, 615-737-7587. We will take a break. Be back right after this.